Hello, friends. Welcome to May's episode of Women's Wellness with Dr. Dow. Our topic for tonight is autoimmune diseases in women. Can autoimmune disease be reversed? Autoimmune diseases, including rheumatoid arthritis, chronic fatigue, and multiple sclerosis, are among the most detrimental conditions afflicting women. In all instances, the body's immune system begins to attack healthy and normally functioning cells. Even more concerning is that autoimmune diseases are the most resistant to diagnosis and treatment. So, how does this specifically relate to women? It matters because women compose the highest percentage of sufferers. And that's really shocking. When we were doing research to prepare for this, it is very shocking to see how many women are impacted by this. And I would say, just by who I see joining tonight, our audience is mostly comprised of women who are in their 40s and higher. So I'm really intrigued to hear about the input that you have tonight for us. I want to welcome you to this discussion with Dr. Dow, and we're going to be chatting tonight about how to recognize the early warning signs and symptoms, what conditions are most prevalent among women, and most importantly, specific methods available to immediately help you to improve or reverse these conditions. So let us help you take control of your health once again. Dr. Dow, thank you so much for joining us. As I mentioned, you have a big fan club on tonight, and we already have questions coming in for you. So I'm just asking everyone to write their questions. We're going to hold them to the end. And in the meantime, you and I will discuss some of the points that I know we wanted to be able to introduce to our listeners tonight. I think first and foremost, can we start by having you tell us a little bit about autoimmune diseases? Because there are over 75 different conditions out there, and this is a grouping. So I'm not sure that a lot of individuals understand how many different types of conditions fall under this category.
Well, there are many diseases and under autoimmune diseases, but I think very first is the understanding what is autoimmune disease to start out. Immune, everybody kind of have an idea. Immune has to do with our immune system, our immunity, and we have a pretty good and sizable immune system that goes around the body and does its work of surveillance and making sure take out pathogens, viruses, such as viruses or bacteria, parasites or any other things that's not supposed to be in the body, and that's what our immune system does. When we have and this is automatic, so in some ways our body has an automatic immune system where the immune system does its work. Now there are some situations where the body's own immune system start to attack itself. And that reasoning could be many different reasons. It could be that the body sees that tissue or that organ, it's been labeled as bad cells or bad tissue, so it attacks it. So in some ways is that the tissue might have suffered some kind of injury, some kind of damage. And so when the body sees that's been tagged, it's trying to actually attack it. And it might be a good tissue, it might be a good citizen, but it's been harassed and it's been attacked. And so in some way, that's a first scenario. And the other scenario could be that actually there is a continuous inflammatory activity and for no good reason at all. So that continues on the loop and it just keep going, and our body needs to shut that down. So we keep on just bringing all the white blood cells and cytokines and trying to work and neutralize that threat. So in that situation, our body has this continuous, you could almost say that autoimmune diseases is like a big inflammation. It's like a battle, but the enemy is yourself. So that happens quite a bit. So a lot of times the conventional therapy for the longest time has been basically immune suppressants, things like cortisones, things like, and some chemo agents that really kills and shuts down tissues or shuts down the immune system, such as methotrexate. And then later on, we now have biologic as well as other what we call more targeted cell therapies, such as Humira and other drugs that we are now into several generations later that we use. And the whole purpose is to trying to get our immune system regulated so it doesn't attack our body itself. So still, we are still not 100% there where we want to be. I think eventually having medicines, whether natural or whether synthetic, where that we can find ways where we can correct this autoinflammation, autoimmune situation where our body attacks is very, very important. So having said that, I think having a combination of using Chinese medicine combined with some of the medications can be very helpful in some of the patients. And there's some situation where just Chinese medicine alone can be helpful. There are several cases I would like to present tonight to talk to everyone about some of my results in treating Crohn's disease, treating multiple sclerosis, as well as scleroderma and lupus and rheumatoid arthritis. There's a few cases where I've treated that actually has gone into remission, and I'm very happy with that. And it's not for everyone, but there's definitely a lot of things that we can do through Chinese medicine, as well as a combination of an integrated approach where we can help our patient to achieve a better well-being with autoimmune diseases. So thank you.
Thank you, Dr. Dao. Now, Dr. Dao, can you explain to us, is there a specific reasoning for why women tend to be more afflicted than males?
Well, we are special, right?
Yes, we are.
You know, I hate to say this, women has more complicated and more complex system, so much further and so much more than men. We are just, our system is more simple comparatively. Women has a lot more systems, such as endocrine system, hormone system, that is richer, that is a lot more feedback loop, is more complex. A woman is wired more complex than a man. Mm-hmm. So there's a lot of different factors. The nervous system, more complicated, more complex. The specific special processes a woman goes through in breastfeeding, in pregnancy, getting pregnant, in the process of labor and delivery, all those things really plays a role in the shifting and changings of the immune system while you're going through your menstruation. So that any disruption of the neuroendocrine system and the reproductive endocrine system by itself can really create some disruptions to the autoimmune system. So therefore, we can see a lot more issues with that. So a lot of times we say that sometimes a hormonal imbalance can be a trigger to some of these autoimmune issues as well.
Okay, got it. Now, how do we know how to identify the symptoms? And just so you're aware, tonight, from what I've seen in feedback, we have individuals on with fibromyalgia. We have individuals on with, let's see here. Oh, they're moving so fast with comments, I can't find the comment now. Asthma, psoriasis, goiter, Meniere's disease, rheumatoid arthritis. Please toss out more. If we should be aware of them, please put them in the comment section and I'll keep letting him know so that he can address this for you.
Yes, there's actually a whole slew of autoimmune diseases that we label autoimmune diseases, but we don't really know all the causes and reasoning for it. Mm-hmm. And it can be ranging from Meniere syndrome to disease such as Sjogren and to rheumatoid arthritis. And they affect women of different age, like for example, rheumatoid arthritis can affect the woman much, much earlier on, just like lupus. But things like MS usually affects women when they are maybe in the 30s into the 40s. So I see that more often in those ages. You can see them in the 20s as well. So they are a lot of times it's different autoimmune, like Meniere is much later. So they are just like different age group can have different things, and some autoimmune disease are more systemic, and some is more localized. So, for example, Meniere is much more localized in one region of the body, which is more the inner and inner ear situations, as well as the balance center. So it just all really depends on which autoimmune disease. And they are kind of different. The way you approach it through acupuncture is very different because they are in different channels, they're in different areas. So therefore, the selection of points and how we see autoimmune disease all differs from symptoms. So you're asking me, how do you know that you are starting to have some autoimmune diseases? A lot of times, some of the symptoms could just simply be fatigue, simply being gland swelling and aches and pains. For example, when your body starts to feel stiff and start to ache, sometimes that could be from beginning of some form of arthritis or rheumatoid arthritis, and then fever, sometimes and skin rashes. Sometimes with psoriasis, you will start having a little rash and begins there. So there are a lot of different symptoms that you could have. But one of the things that a lot of women tell me, one of the major symptoms is fatigue. It's an unusual fatigue. That's when you start to say, okay, what's going on? And take a look at your life and see if there's anything that might causing the fatigue. If there's nothing that's causing the fatigue, we need to examine and investigate. So things like FMA, fibromyalgia, and this condition is still basically still progressing in the sense of we still don't have a good grasp of 100% grasp of what this disease is all about. I mean, we basically define it by all these trigger point understanding, but reality is much greater than that, and we don't always have the best grasp. So we try to manage this condition, trying to manage the symptoms associated with these conditions, and hopefully one day, with better research and with more understanding, we can find cures and deeper understanding of these diseases.
Okay, thank you. Let's just talk on a philosophical side of it, of how can a woman navigate a chronic condition like this while still trying to be present as a primary caretaker, and in some instances, the major source of household income? Because in addition to the condition itself, I think women feel so weighted down by our responsibility as caretakers. I
think that you hit the nail on its head. I think that's an English expression.
Yes.
It's that almost any autoimmune disease, it requires you to be having much less stress, having much less stress burden. And that's literally impossible for people living in this world where that you have to make some money and you have to support yourself. And that seems to be quite impossible. But there are ways around it. A lot of times, it's very important, if you know you have an autoimmune disease, is to really solicit support. Either solicit support from your family or solicit support from your friends. Your friend needs to know that. Your friend needs to understand your needs and trying to really work with you and help you with whatever resources they can do to help you. Autoimmune diseases for some people, it's a lifetime situation. Even if you go into remission, a lot of times you still need to keep a good balanced lifestyle. So what that means is that you cannot overburden your system. You cannot try to exhaust your body too much. You cannot have a lot of stress in your life regardless. If you're feeling better, you still have to be very careful. So to answer your question, I think is the support system, I think is the number one most important thing. To have someone, to have a group of friends or a close intimate partner, as well as parents, family, and doctors that who really appreciate what a patient goes through, who can be that support system for the patient. I think that's paramount.
Okay. Thank you. Now, we have in our audience, they've been writing in their conditions, and just to add to the list I gave you before, we also have an individual with lupus, let's see, hyperthyroid, as well as, oh, I just lost it again. They're writing so fast that I see it and then it disappears on me. It was the individual who just, Leah, if you can find it, please. It's the one that would have been under about lupus.
There's lupus, there's Graves' disease. We can talk a little bit about Graves' disease. Graves' disease is basically hyperthyroid, where the thyroid gland is just overactive and is attacking itself. But that's a hyperactivity of the thyroid. And we even sometimes things like Hashimoto thyroiditis, even though that is a chronic inflammation infection situations, a lot of times we can also consider that as an autoimmune thyroiditis situation. So these group of conditions really affects women greatly. And a lot of times it causes very strong mood changes and make them very difficult to socialize and be able to work and be able to just lead a normal life in the most severe form. So some of these situations, we have to medicate the patient to stabilize it. And a lot of time we will use adjunctive therapy such as acupuncture and Chinese herbal medicine to deal with some of the symptoms where some of the medication just doesn't touch. So these are kind of things that I often work with my immunologist, or sometimes we call it rheumatologist, with some of these diseases. These days, rheumatologist does a lot of infusion therapy. And infusion, these are targeted cell therapies of biologic that is very helpful. And some of the patient has to be on it. And some of the patient can actually get better with less and less biologic. It can be done. I can just jump into, I actually had a patient who has Crohn's disease, and in a situation where that he was on the biologic and was on the Humira, and but wasn't getting not much better, still having a lot of diarrhea and mucus and bleeding in the bowels. So with the acupuncture and Chinese herbs, he got a lot better. And with the blessing of his immunologist, or actually Crohn's disease specialist, we were able to slowly, gradually reduce a Humira, and we were able to get to a point where that we were not using any more biologic, and was able to get him completely in remission. And I was very, very thankful and very happy about that. And the patients are actually very happy in that instance. But it's not everybody can achieve that, but we try to work together to see what we can do to actually cure the condition. We know that autoimmune disease, a lot of time, is very hard to have a cure, but nevertheless, we must always work toward it. So first of all, we try to manage the condition, and then we try to do whatever we can do to make goals, make small step goals to trying to go toward that cure possibility. And that's what I'm trying to do. And that's what most rheumatologists are trying to do. So I hope that helps.
Okay. You had mentioned earlier that you had some case studies you wanted to share with us. Perhaps right now is a good time to do that. because we have such a variety of individuals on tonight that hearing you walk through some specific studies that you've experienced might resonate well for them.
All right, so I went through Crohn's disease. I also just recently have a case of multiple sclerosis that is in remission, in the sense that her symptoms are much reduced, and not only that, her energy has returned, and her disease has stalled. That means has not progressed. So that is actually wonderful. Without any medication, she's able to lead a fairly normal life. Her tingling and her numbness is much reduced, and in some ways is almost disappear. But there are times if she gets too stressed out, and if she do too much, shall we say, physical activity and exercises, she kind of burn the candle on both ends. Sometimes you're going to get some tingling and numbness back. Her body will tell her, say, listen, I don't like it. Whatever you're doing, you got to stop. So, but it was a wonderful case where the MS was in remission. I also had a case of scleroderma, where the scleroderma was cured. This woman had a scleroderma situation, and then where that the condition has basically gotten better, the skin and her belly, as well as her arm, all the hardness of the skin basically receded, and she was seeing a rheumatologist and followed up by a rheumatologist. We were able to get her muscle enzymes way down to normal. In fact, the rheumatologist, we have a good rapport and good communication with rheumatologists, and we're able to really confirm that she was indeed in complete cure and remission at this point. So from scleroderma, for example, and that's not every case. Again, this is a few cases here and there, and they are not the most easy thing to treat, but I am very happy that if we're able to get a patient toward that, it's really happy to be able to see that. So I don't know if we can cover all the other ones. In 1987, I had the fortune to work in a specialty clinic in Beijing Dongzhimen Hospital, where we were doing side-by-side with acupuncture and Chinese herbs with rheumatoid arthritis. So I spent a lot of time on the rheumatoid arthritis front as well. So they all have, all these autoimmune diseases all have very distinct differences, but they also have some similarities. And the similarity is that you could almost say the body has this big inflammation. And that inflammation is in different locales, in different areas, in different systems. And that inflammation is incessant. That means it never ends. It just keeps on building on top of building. So it's very chronic. It doesn't like to go away. So a lot of times, I believe one of the things, and what I try to do with patients, the number one, the very first and the most important thing has to be nutrition. And and I actually have a wonderful nutritionist who actually does this for a lot of autoimmune disease patients. You have to eat right. And there are certain foods that can create irritation to our immune system. We have to stop. And things such as sweets, things such as alcohol, even sometimes in certain cases caffeine, are not the most, it's not great for our body. Even though I don't care how much research is out there. For example, caffeine, coffee is really good for you. A lot of research have shown that. But you know, it's good for you when you are normal, when you're healthy. But when you're sick, it just becomes a burden for your system. So it's not really a good thing for you in those kind of situations. So I try to work on that. And for some people, gluten is an issue. Now, some people are sensitive to gluten, but some people are allergic to gluten. People who is very, very allergic to gluten, they can have vomiting, they can have diarrhea, like celiac disease. We always have heard about that. And then there are situations where people are just distinctly very sensitive to certain foods. So we have to be careful with certain foods. So sweets, alcohol, chemicals, caffeine. We have to be very careful. And some people, dairy product may not work for them that well. We often stress and emphasize the importance of fresh vegetables, fruits, and if you are able to handle gluten, make sure that the grains that you do is whole grain. Try not to get polished or enriched grains. If you can handle rice, make sure you get brown rice. Wash really carefully because some rice have arsenic, but if you wash really carefully, you should be able to get rid of a lot of that. So these are kind of things that you can be very careful, and you can do a good job with your diet. So that's the very first thing. Second is lifestyle. I think that's so important. In a lifestyle, the big part of a lifestyle that really important is sleep. I can begin to emphasize the importance of sleep, because if you don't sleep well, you sleep shallow, you don't have enough deep sleep, your body just don't recover and don't repair. So a lot of times when we treat patients with autoimmune disease, actually when we treat patients with any kind of disease, including fertility issues or women health issues, sleep has got to be number one thing that we look at in their lifestyle. And so a lot of times if we have a condition we are treating, but their sleep is not so great, we actually work on the sleep first. Try to get them a good sleep hygiene, get them to go sleep by 10 o'clock, trying to get them to not go to sleep so late, shut down their their iPhone, iPads, Netflix, binging, Game of Thrones. Oh, you can't start that. If you start, you can never stop.
Oh, I'm there. You're not going to stop me because there's only 2 episodes left.
I know, but it's like I did not participate in HBO Game of Thrones from the very beginning, so I just can't start, because if you start, you want to go back and watch that whole, I don't know how many episodes, like what, 60, 70, 90 episodes?
Yeah, 9 seasons, I believe.
Yeah, I mean, my eyes gonna pop out, I can't do it. So anyway, so those are kind of things we have to be very careful, looking at our addictions, looking at our tendencies, and try to be very conscientious of our lifestyle. Fresh air also plays a huge role too. Good water source, fresh air. These are things that, we consider them basic, but actually some people have issue with it. So I actually go through it routinely with my patients to make sure that my patients are getting the lifestyle in a good place, and stress level, handling stress level is also very important as well. Thank you.
And in respect to, you said that there's a nutritionist on hand. That nutritionist would provide them with a customized meal plan according to their condition?
Yes, there are actually, nutritionists, they're specialists. And they are general nutritionists, and they're also clinical nutritionists, and they are specialized nutritionists. They are nutritionists that specialize in certain conditions. So and autoimmune disease, you really need a specialized nutritionist. You cannot just get a general nutritionist. There's just so much to cover, so much knowledge to cover in that. And it's not about supplements. It's just simply that there's certain food that people are just so sensitive to, and it's not, and you don't want to do a lot of trial and error, because the trial and error, you get sick, and you get sick too much, and you don't want to do that. So a lot of times I rely on several nutritionists, especially there's 1 or 2 people that's just very, very good for rheumatism, very good for autoimmune diseases, so I refer to them.
Okay, wonderful. Now, what about, I know on the nutrition level, then we'd rather they go through a nutritionist specific to their condition. On the stress level side, the immunity herb side, do we have products we can recommend to them, or do you feel that this truly should stay custom?
Yeah, I think and that's one thing that I think we need to talk about this, is that immune system originates from your guts. Okay, it really starts from digestion. So, answer your question. You did ask me what are some of the symptoms that you would see. I did say fatigue at the very beginning.
Yes.
But the reality is, a lot of people is actually dysfunction in their guts. Okay. A lot of times it could be from overuse of antibiotics. Or where that their bacteria balance is off in their gut area, and that could create a problem. So in people who has used a lot of medication in the past, or whose digestion always has been poor, I a lot of times look at what they need, and sometimes some of these patients would require things like probiotics. Okay, so some of the things like probiotics, especially people who are constipated a lot, the probiotic can be extremely helpful. So I usually, and with constipation, I usually try to start something easy, mild. Nothing that's kind of addictive or habit forming, so to speak. So things like fiber, things like probiotic, which we do have a product.
Yeah, I have it here.
Yeah. So that's a very good formula that sometimes I would use, especially in the type of person whose bowel movement is sluggish. You might have a person who might have loose stool, but if their bowels are sluggish, you can still use it. It does work quite well with probiotic. So that's one of the things that I would usually do to help. Now, I say earlier that I talk about sleep issues. That's such an important thing. Of course, we have some supplements that people can take that kind of calms them a little bit, helping them to sleep better, especially people who just couldn't do it, even though they have good sleep hygiene. So sometimes I would start them with something mild. We have some sleep supplements that they can take. They can try that, and that sometimes can be really, really helpful. And then otherwise, I would give them medicinal herbs to help them with their sleep. So these are the sleep formula. The probiotic can also be very helpful. And then there's also a calm formula. I think there is aromatherapy calm formula that we use that actually it's when you smell it, when you breathe it, it actually calms your system. And that sometimes can be helpful for anxiety and reduce some of the stress reaction that you might have. So I think those are the three things that we have that can be very helpful, just in kind of general helping and general supplementation. But ideally, I think when you have an autoimmune disease, you really want to find a team of doctors who can really work with you in different aspects. Thank you.
Thank you. And thank you, Leah. Okay. One last question from my end, and then I think we should open it up to the question because we have so many questions from everyone, and I want to try and be able to give you time with them as much as possible, if that's okay with you. Yeah?
Absolutely. Go ahead.
Okay, so we do have a question about how does this impact pregnancy? If a woman is wanting to get pregnant, or she is pregnant already and finds out, how does this impact her pregnancy?
Well, first of all, if you have autoimmune disease, and a lot of times or sometimes it could actually impair your ability to get pregnant. It can also cause more frequent miscarriages. For example, diabetes. Some of the diabetes situations are autoimmune situation. So that can be a problem. So, it's a situation where that I had a patient who had rheumatoid arthritis who was in the process of trying to get pregnant, and it was a very difficult situation. We were able to help her to get pregnant, but she still has to be on some of the biologic during the whole process. So it wasn't a very easy case, and she endured. She was able to go through it, and baby is fine, is healthy. So it can be done. But it's very important if you know you have autoimmune disease and trying to get pregnant to really work really hard to trying to get the autoimmune disease down, quiet down before you're trying to get pregnant. But nevertheless, it's not going to be an easy thing. There's usually more impairment and more infertility in those situations.
Okay, thank you. Okay, let us jump into questions from the audience then. First question, anything that you can suggest for fibromyalgia pain, especially when it's a flare-up day?
Well, it's, first of all, we are dealing with pain management. So pain management, there's many different things. I mean, in the old days, we try, and even in a harder situation, Some doctor would use opioids, but we don't do that anymore, and we try to stay away from that. Acupuncture treatment actually can be really soothing. It's actually been helpful for some of the patients with FMA, fibromyalgia, and as well as massage. Some of the gentle massage and acupressure can be very helpful. And there's some Chinese herbs that you can take that can help to release some of the pain. That can be very helpful. Even sometimes, it doesn't always work with everybody. A little bit of ibuprofen sometimes can be helpful also as well. Some people take NSAIDs, non-steroid or anti-inflammatories. That sometimes can be helpful also as well. But I don't want people to get into a habit-forming situation. I don't want somebody to just keep taking that. I think it's important to try to manage it so that the pain level goes down, so that you don't have to keep on taking something to manage pain. Interesting enough, biofeedback and meditation, hot bath can actually be also very helpful. Interesting enough, exercise is also helpful. I have a patient that has fibromyalgia and it's just painful. So what she does is that she just basically take a slow walk first, and then and through the first hour walk, she will be in pain. But after the first hour of walk, her pain starts to subside. And into the second hour, and her pain literally completely gone. So she realizes she's got to get up and get going and start exercising, and so that you can get all that endorphin into her system. And but when you're in pain, it's a little hard. But you can get to it. If you can get to it soon enough, you can really get going to relieve some of this pain right away. So those are some of the things. Infrared sauna, some people find that to be really helpful to deal with the pain also as well. I hope that helps.
Mm-hmm. And infrared sauna, we have that at our clinic at Santa Monica that they can come and use, correct?
Yes, a lot of acupuncture clinic should be able. I think not every clinic has it. We do have a very good infrared sauna tunnels that people can actually use that works really well.
Okay, if you can help us too, Dr. Dow, they want to be able to see links. If it's something that's like a herb, if you mention an herb and it's something that isn't prescription based, that it's over the counter, let us know. And Leah's posting a link so that they know where to go to for that. And if it's something our clinic has, let's just let them know so they know what they can achieve from the clinic versus something that has to be outsourced. Okay, next question. What recommendations do you have for narcolepsy?
Wow, that's a big topic. Yeah, that's not an easy condition. I have several cases that I have treated in this last 2-3 years. Narcolepsy is a situation where you literally fall asleep anytime, any moment, and is a very dangerous condition, and it requires a lot of supervision, and you really cannot drive. You have to be so careful. So I have patients who actually their relative bring the patient in for treatment. I have a few cases, and I think that has a lot to do with the central nervous system also as well. So what we do is acupuncture really releases endorphins and actually balances out serotonin and endorphin, increases all those activities. So that actually can be very helpful. They are what we call happy chemicals. And so what that does is it excites the neurons a little bit more. So what I do in that situation, I would usually also combine with acupuncture. I would use herbs such as Simicifuga, we call Simicifuga, as well as Codamnopsis, as well as Astragalus to treat this condition. As I say, it's not an easy condition, but I was able to help some of these cases to feel a little bit better, in the sense is that they don't just knock out so quickly, and they are able to control a little bit better. But it's not an easy condition to manage. So thank you for the question, though. Thank you.
Thank you. The next question is, what herbs can you recommend for AL disease? This individual is currently taking Chinese herbs and has the symptoms of AL disease. So that's
AL, ALS or AL what? I'm sorry, I didn't understand.
in perhaps if that person wants to send again to Leah right now, I read it as AL disease.
Okay, all right.
ALS.
Yes, enlighten me so I can make some sense out of that. Thank you.
Okay, we'll come back to that one then. Next is lupus related to the immune system?
The uterus?
No, lupus.
Oh, lupus. I'm so sorry. Of course, lupus is one of the main and major autoimmune disease of the body. And you probably have heard of lupus flares and the butterfly rash that's on the face, and as well as different rash in different areas of the body. The lupus is very damaging to the skin as well as the fascia, the tissue systems, and the muscles as well. What we're trying to do in that situation is a systemic, most lupus is a systemic issue. So we're trying to calm down the immune system so the immune system doesn't fight itself. Actually, there are some studies that have shown that acupuncture and Chinese herbal medicine is actually helpful in quite a few cases of lupus conditions. I have good experience with lupus patients with acupuncture and herbs where that we can actually calm down some of the flares. So I hope that helps.
Okay, thank you. Hold on one second. Our individual right before that meant to say autoimmune disease, not AL. So hopefully some of the things you've already responded to, we're able to help her and support her, but we're just checking to see. So we'll get back to you on that one. The next one is the theory of increasing overall alkalinity to prevent autoimmune issues and inflammation.
Okay, so it's very interesting. I think there is this whole concept of alkalinity and alkaline water. It's quite popular in the sense that it seems to be helpful for some people in the sense of reducing acidity, which can reduce inflammatory activity. Inflammatory activity creates kind of like an acidosis kind of condition. So the whole concept is that if we drink more alkaline water, it can reduce some of the acidity of the situation. It's the concept is sound. The practice doesn't always work exactly as supposed to be. And the reason being is that the alkaline water, when you drink it, it does help in some ways, but when it gets into your stomach and when it gets absorbed, it gets neutralized. The effect of the alkaline water doesn't reach that deeply to other part of the body. So it may not necessarily work as well. Some people swear by it, and some people feel like when they drink the alkaline water, they can actually reduce inflammatory activity in their body. If that's what you feel, then be my guest drinking it. That'll be fine. Just realizes that your body has a tendency to actually change the alkalinity and the pH of the water that you drink eventually anyway when you get into the stomach. So I don't want people to spend so much money just to do alkaline water, but if you can try it and see how that works for you, and some people does feel like it's helpful for them.
Okay, thank you. Next question, what does red splotching bruising of the tongue indicate?
Wow, that's a Chinese medicine terminology. If you have red blotching of the tongue, it depends on the location of it. Yeah, obviously, this could be some kind of inflammatory activity of the tongue, but a certain location, it depends on what area is blotchy. And a lot of time, the front of the tongue tends to denote the upper part of the body. The middle of the tongue tends to denote the middle part of the body. And then the back of the tongue tends to denote the lower part of the body. So a lot of time we use that as a diagnostic references to see where the problem might be. And that's how the Chinese medicine look at things, is by the sensitivity that reflects onto your tongue. You see, your tongue is a very vascular organ. And then so any changes in the body in vasculature can actually shows up in the tongue. As well as the coating actually shows up the digestive function of the body and how well you digest. If you eat a lot of rich food and you're not digesting very well, then the coating gets very thick. If you have a yeast infection, the coating also gets very thick. If your digestion is doing very well, then the coating becomes much thinner, and a lot of times it's transparent and clear. So these are some of the things that we look for in a tongue diagnosis, in the reflection of how our body is doing.
I'm sorry, I know I'm smiling on the other end, and it's because the little girl in me has a visual of us all running to the bathroom to check our tongues now.
Yes. Yes, actually, as a doctor of Chinese medicine, sometimes I stick my tongue out into the mirror in the morning and see, how do I look today? And yeah, it actually helped me because I, in Los Angeles, we get allergy very easily, especially for me. And so a lot of times when I look at my tongue, I actually can tell how much, even though sometimes I can't tell how much congestion I might have, the tongue actually can tell me whether or not I'm more inflamed or not as inflamed. So that's actually very helpful for me.
That's fantastic. Okay, next question. Do you believe that autoimmune disease can originally start from a virus like Epstein-Barr? What are good recommendations to start to heal from that, since there is no cure for it?
There are a lot of theories of autoimmune diseases. And it is true that there is a possibility that virus can actually attack and create an autoimmune disease situation. Okay. So that is known to be true. And so it's just that sometimes we don't really know if that's the true cause, because there's no way we can go back in history and figure that one out, except that somebody who developed autoimmune disease after, for example, a virus, for example, a flu. So we put that together as a possibility of that's a cause. And I think you were saying about condition? I'm sorry.
No, they wanted recommendations to start healing from this.
Epstein-Barr, I think it's the Epstein-Barr virus.
Yes.
Okay. Epstein-Barr virus, I think in the old day, we used to call it chronic fatigue syndrome. I think we still call it that way, but a lot of time we are now mixing it with FMA, fibromyalgia now. So with the Epstein-Barr virus situation, if you have a high titer ratio, and we don't usually go by all those lab tests as much now as going by your symptoms. And so a lot of times, again, we go back to the basics. We look at the nutrition. We look at your lifestyle. This got to be the first thing. And a lot of times, just by looking at that, working with that, you can beat the Epstein-Barr virus symptoms, such as chronic fatigue, the fatigue conditions. And the other thing is we usually give some Chinese herbs and acupuncture help to stimulate and work with your immune system so you can get more balanced. So you can put it in remission. There are plenty of people who has put their chronic fatigue syndrome into remission, so it can be done.
Okay. Thank you. The next one, reflex sympathetic dystrophy. What do you recommend for this? And particularly, she wanted to know if there's any herbs that could be used for this. And
yes. Yeah, there's actually some scalp acupuncture techniques that we have known that can help with reflex sympathetic dystrophy. There are some scalp points that we use on top of the head. That helps with reflex and central nervous system, as well as the peripheral nervous system, to work together to calm down some of the excessive impulses. And so it gets the nervous system into balance. And so having said that, some of the scalp acupuncture also has been used for MS as well. It's a wonderful not discovery but creation by a very famous acupuncturist in 1980s or 1990s that came up with this idea of what we call the waking up the brain technique. It was originally used for stroke patients to trying to wake up the cognitive function of the brain in a brain thrombocytic or thrombosis situations. But in this situation, we have used this technique for all sorts of neurological, autoimmune and neurological symptoms.
Okay, thank you. Next is eczema. What do you recommend for eczema?
Eczema, commonly known as atopic dermatitis. This is actually one of the most common form of skin problem, especially in children. And we treat a lot of eczema here. Obviously, eczema is, we need to basically make sure we control the symptoms, and mostly is the proliferation of this dermatitis. And so a lot of time we use some herbal creams, and we also realize that this is really a immunological, like allergic type of situation. So a lot of time we assess the nutrition, we assess the food. We try to, one of the things very important is that kids, when they're growing, you don't want them to eliminate everything. Because if you do, you start to create a malnutrition situation. So you're going to just make the condition worse. So a lot of times you want to look at a balance of diet. You want to pick one or two stuff that's in the food that may not be good for the patient, looking at some of the food formulas that they are using. And then not at least, looking at their bowel movements and looking at their basically their height, their actually lifestyle. Are they sleeping well, and that kind of things. I think that's very important. So we usually prescribe herbs internally. That's actually what's going to work in the long run to help to reduce the eczema occurrence into the future. So that's what we're trying to do, is give some herbs internally to help to balance and relax their allergies, relax their immune system so that they don't fight themselves so much.
Okay, and is that customized at the clinic, or would that be something like our community?
You have to customize for each patient. We also customize acupuncture treatment with different points. We use different points for those kind of conditions. We treat a lot of kids in this clinic. Unfortunately, this is a condition that is nasty. It's just no fun. I mean, seeing your kids scratching all over the place, it's just not, it's painful to watch. So we try to control it and knock it down. And the conventional method is using some cortisone creams, but unfortunately some of the cortisone cream doesn't always help. It helps in majority of cases, but a lot of times it just comes right back. It flares right back. So we are trying to look for long-term solution. But for other mothers, you realize is sometimes and a lot of times kids do grow out of their eczema as they get older. So there is definitely some end in sight sometimes, or better in sight as time goes on.
Okay. Two more questions. The next one is, on the topic of pain management for rheumatoid arthritis or fibromyalgia, will cannabis help, or is it harmful in the long run?
Okay, well, we know that CBD, without the THC, basically is an active component of marijuana. The CBD is actually has known to relax the nervous system and has known to help chronic pain in certain circumstances. I don't think it works for everybody, but I think it's worthwhile to try. It's non-addictive, and it seems to work quite well in relaxation as well as pain management. So I think the CBD is something that we can consider. Now, the THC, and part with the CBD, I think the jury is still out in the sense is a pretty potent component of marijuana. We don't really know how well that's going to work and whether or not there's an addictive quality to it. So I cannot comment on that. We are still at a very, very early stage in looking at that part. But I know, and I do know CBD does work and does help in certain populations.
Okay, thank you. And then our last question for tonight is, what do you recommend for osteoporosis? Could it be reversed or mitigated?
Well, osteoporosis is not really a autoimmune disease, but I'll talk about it. I think the white female tends to get more occurrences, tends to have more risk for osteoporosis. I think the most important thing is to deal with it before you get to osteoporosis. Don't wait until it's osteoporotic. Trying to work with it. And a lot of times before you go to osteoporosis, you already have some aches and pains. Osteopenia is basically one level, close to osteoporosis. So you want to deal with it when you have osteopenia. Several things. A lot of time it occurs starting from menopause and into the menopausal, postmenopausal situation and time. There's several things you can do. First of all, making sure that you have enough vitamin D supplementation. That can be helpful. And the other thing is diet is also very important. The Chinese diet really like to eat a lot of tofu as well as bones. I mean, we chew on bone marrows all the time. We eat bone marrow, we chew on cartilages. So Chinese says this whole concept, if you're going to build bone, you got to eat bone. So a lot of time we do that. So that's one thing you can do. And not the least is exercise. You got to make sure you do some weight-bearing exercises. And one of the things that I tend to like to tell my patient to do is do some hiking. Do some walk where you can put some strain on your spine, and you can actually get yourself a camelback, get yourself a backpack that is very much, fits into your torso, and to carry some water bottles. This is your very easy weight-bearing exercise you can do that can really strengthen your bone structure. So these are kind of things I recommend. As much as we want to encourage to eat, we also need to discourage certain things that's not so good for osteoporosis. Obviously, using cortisone can actually thin the bones, and anything such as female hormones. Sometimes there's some deficiencies of the female hormones. Sometimes that can also cause issues in the bone density. So sometimes we want to balance the hormones, not necessarily cause an excessive amount of hormone, but more balanced hormone, and those kind of things that can be really helpful. But I think exercise, lifestyle, eating correctly can all be very helpful. And also don't forget, do some acupuncture and herbs. I do have a patient who recently had an osteopenia of, I think is T-score minus 2.2, and we just got it to minus 1.7. So we are reversing. It can be reversed, and without actually, sometimes can be reversed without medication. The only thing is that this is a long-term therapy. This is not something that you can overcome it overnight. It takes several years to really get to a satisfactory state. Well, thank you.
Thank you, Dr. Dao. I'm sorry, there was a part two as well to this. You're being asked, what are general herbs for autoimmune diseases? Not specifically a formula per se that we have, but general herbs that are preventative.
Well, there are herbs in many different categories for autoimmune disease. diseases, I cannot really tell you one or the other, because I think every patient requires a modification and formulation together. But there are definitely herbs in the areas of, in Chinese medicine category, in the areas of clearing heat, relief toxin, and as well as for indeficiency, false fire syndrome. That's the kind of herbs that we use. Rima is one of them. Romania is another one of them. We also use things like Nonicera for CTI. There's a lot of different herbs that you could use, but we have to kind of diagnose it and prescribe it in a synergistic formula form so that it can help. Like, for example, I'm going to pick up this herb here. So a lot of my patients would take herb forms such as raw herbs. Can you see it clearly here?
Yeah, come to the other side a little bit. There we go.
Yeah, raw herbs. You can see raw herbs. They put together their twigs and plants and leaves. We prescribe some of these herbs quite frequently for all different conditions. And then we also prescribe it into kind of like a powder form. So I don't think people can see it.
There we go. Yeah, okay. A little more.
Yeah. So this is a powder form, and then they can just put hot water and make into an instant tea, and that's how we do some of these conditions. But these are, for example, these herbs can be a mixture of anywhere from 6 to 15 herbs for different conditions, and a lot of time they get prescribed and they get modified on a regular basis, sometimes weekly basis, until we get stabilization of a condition.
Okay, thank you, Dr. Dao. Thank you everyone so much for your questions. We are going to need to start wrapping up now. If you do have questions after this episode, you are welcome to send them in to marketing@infinici.com, and I will pass this over to Dr. Dao to respond for you, and then we'll put it up when we do at the end of the month a recap of all of the videos and teleplays. But it's been a long night, and I can see that Dr. Dao needs his rest too. So we're very, very appreciative, though. It was fantastic having so many of you on tonight. For you, Dr. Dao, is there any last advice, wisdom you would like to share with us as we conclude for the evening?
I think the number one thing about autoimmune disease is, again, get good support. But most important, we need to strengthen our spirit, because this is not a short-term problem. This is a lot of time long-term problem. So we need to have a strong spiritual resolve and keep learning. The truth is, when you have this disease, you become the best doctor of your disease. No doctor can be better than you. We can learn a lot from you, and we can learn a lot about medicine, and we can assist you. But only you can know your condition the best. And we will be here to always help you, to be there to actually learn from you, and to really give you some ideas what research has been doing and what other patients been doing. And the more we can share, the more we can help each other, is the better the world is going to be in a world of autoimmune diseases. So thank you.
We're very appreciative to you, Dr. Dao. Thank you so much for taking time out of your schedule tonight to come and be with us. I think that you've been able to answer so many questions, and I really hope this will be beneficial for our audience. To our audience, we'd like to thank you again for joining us tonight. We will be back on Wednesday, May 29th from 5 to 6 p.m. for the Healing Hour. And in that topic, we'll do a deeper dive into the warning signs of autoimmune diseases. That will be with Albert Vaca, the head of our Pasadena clinic, as well as Sally Golubov, who has been on maternity leave and just returned back to our Santa Monica clinic. So they both are very wise in this area too. And certainly if you have questions and you don't want to send them now, you can hold them until the end of the month with them. So thank you for joining us, and we hope you have a beautiful evening, and we will see you again in a few weeks. Take care. Bye. Bye, Dr. Dao. Thank you.
Thank you. Bye-bye.
Bye.